Hey everyone, and welcome back to the channel. Today, we are tackling a topic that is super common but can be really miserable: vomiting and diarrhea. We've all been there, and it's no fun. But what's actually happening, and when should you be concerned? Let's break it down. Most of the time, when you suddenly start vomiting or having diarrhea, it's because of a viral infection, often called the stomach flu. The good news is that these episodes are usually short-lived, lasting about 2 to 5 days, and they typically go away on their own. Let's start with nausea and vomiting. Nausea is that awful, queasy feeling that makes you think you're about to be sick. Vomiting is, well, you know what that is. It's a common symptom for a whole range of issues. If you're experiencing this, it's helpful to think about a few things. How long has it been going on? Can you keep any food or water down? What does the vomit look like? Is it just food, or is there blood, or something that looks like coffee grounds? Also, consider if you could have been exposed to a bug. Think about recent meals. Did you have any reheated rice, or maybe some undercooked chicken? Have you traveled recently, or has anyone you've been in contact with had similar symptoms? It's also important to note other symptoms like fever or abdominal pain. When a doctor examines someone with vomiting, they'll focus on hydration. They'll check your blood pressure and pulse, look for a dry mouth, and assess your skin. In babies, they might check for a sunken fontanelle, which is the soft spot on their head. These are all signs of dehydration. They'll also examine your abdomen for any tenderness, swelling, or unusual bowel sounds. Now, let's talk about diarrhea. First off, what does it actually mean? Medically, diarrhea is the abnormal passage of loose or liquid stools, more frequently than what's normal for you. Like vomiting, it has many potential causes. A key question is how long it's been happening. If it lasts for more than 4 weeks, it's considered chronic. The nature of the stool is also important: its color, consistency, and whether there's any blood or mucus. Speaking of mucus, if you ever notice a slimy stool, this can be caused by excess mucus from the large intestine. It's often linked to conditions like irritable bowel syndrome, or IBS. If you're over 40 and experience this, it's worth getting it checked out. Similar to vomiting, a doctor will want to know about your recent travel, contacts, other symptoms like fever or weight loss, and any potential food intolerances. Your past medical history is also relevant, especially any previous surgery, pancreatic issues, or conditions like diabetes or thyroid disease. Family history of bowel conditions is also a key piece of the puzzle. So, how do you manage acute diarrhea and vomiting at home? The number one priority is rehydration. Drink plenty of clear fluids, like water, broth, or special rehydration salts that you can get from a pharmacy. The key is to take small, frequent sips. Don't gulp down a huge glass of water all at once, especially if you're feeling nauseous. When you feel up to eating again, stick to a bland diet. Think toast, rice, or bananas. It's best to avoid dairy products until you're feeling much better. For babies, they should continue with their normal breast milk or formula. When should you see a doctor? It is important to seek medical advice if you are showing signs of dehydration and can't keep fluids down, especially for children and the elderly. Other red flags include a high fever, blood in your stool, if you work with food, have recently returned from a trip abroad, or if your symptoms just aren't getting better after a week. In these cases, your doctor might ask for a stool sample to figure out exactly what's going on. Remember, most cases of vomiting and diarrhea will pass on their own with some simple home care, but it's crucial to listen to your body and know when to seek professional help. Your health is the most important thing. If you found this information helpful, give this video a thumbs up and subscribe for more content. Thanks for watching, and stay well.